7 warning signs of a stroke. A stroke happens when blood flow to a part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Within minutes, brain cells begin to die. Recognizing the warning signs of a stroke can save lives and reduce the risk of long-term disability. But first, subscribe to the channel if you haven't already.
Please.
Warning signs. 1. Sudden numbness or weakness, especially on one side of the body. This can affect your face, arm, or leg and often comes on suddenly. Imagine trying to smile and realizing that one side of your face isn't moving, or lifting an arm and finding it unexpectedly weak or heavy. This can make daily tasks like eating or brushing your teeth difficult and frustrating. Picture waking up one morning, reaching out to turn off your alarm clock, and feeling your arm unusually heavy and unresponsive. It's as if your body is sending a signal that something is fundamentally wrong. This numbness or weakness isn't just a fleeting sensation. It can persist, interfering with your ability to perform everyday activities like cooking, driving, or even walking. This symptom is often the most recognizable and alarming because it directly impacts your physical capabilities and quality of life. 2. Confusion or trouble speaking and understanding speech. You might suddenly find it hard to speak or understand what others are saying. This can be incredibly frightening and disorienting. You might slur your words or have trouble finding the right words, making conversations challenging and causing misunderstandings. Imagine being in a meeting at work, trying to explain your point of view, but the words come out garbled or don't come out at all. This difficulty can make you feel isolated and frustrated, as if your thoughts are trapped in your mind and you can't communicate them. It's not just about speech. Understanding what others are saying can also become a challenge. You might find yourself nodding along in conversations, not fully grasping what's being discussed. This confusion can extend to reading and writing, making it hard to send emails or understand written instructions. Have you or someone you know ever experienced this? Share your experiences in the comments below. 3. Sudden trouble seeing in one or both eyes. Vision problems can occur suddenly, making it hard to see clearly. You might experience blurred vision, double vision, or even loss of vision in one eye. This symptom can be subtle but is a serious warning sign. Imagine trying to read or watch TV and suddenly finding your vision compromised. You might see everything through a foggy lens, or it could be as if a curtain has been drawn over one of your eyes. This change in vision can make navigating your environment challenging and dangerous. Crossing the street, driving, or even walking downstairs can become hazardous. This sudden visual impairment can also affect your balance and coordination, making it difficult to perform tasks that require precise hand-eye coordination, like cooking or typing. It's a stark reminder that your brain's control over your sensory input is compromised. Have you ever experienced sudden vision problems? Let us know how it affected you. 4. Severe headache with no known cause. A sudden, intense headache can be a sign of a stroke, especially if it comes with other symptoms. This headache might be described as the worst headache of your life and can occur without any obvious reason. It can be so debilitating that it prevents you from performing daily activities. Imagine a pain so severe that it feels like your head is about to split open, making it impossible to focus on anything else. This type of headache can strike out of nowhere, leaving you incapacitated. Unlike a typical headache, this one doesn't respond to common pain relievers and may come with additional symptoms like nausea, vomiting, or dizziness. It's not just a headache, it's a warning that something is seriously wrong in your brain. If you've ever had a headache like this, how did you cope with it? Share your tips and experiences. 5. Sudden trouble walking, dizziness, or loss of balance and coordination. You might feel suddenly unsteady, have trouble keeping your balance, or feel dizzy. This can make it hard to walk or move normally, and you might feel like the room is spinning. If this can increase your risk of falls and injuries, making it dangerous to move around. Imagine standing up and feeling like the ground beneath you is shifting, causing you to stumble or fall. This loss of balance can make simple tasks like walking to the kitchen or getting out of bed a risky endeavor. You might find yourself holding onto walls or furniture for support, constantly worried about falling. This dizziness and loss of coordination can be particularly unsettling, as it affects your ability to move safely and independently. Have you ever felt this way unexpectedly? What did you do to regain your balance? Let's discuss in the comments. 6. Sudden numbness or tingling. This might occur in your face, arm, or leg, typically on one side of your body. It can feel like a pins and needles sensation and may come on suddenly, leaving you feeling disconnected from your body. This can make it difficult to perform simple tasks like holding a cup or using a fork. Imagine reaching out to grab a glass of water and feeling a strange tingling sensation in your hand, making it hard to grip the glass. This numbness can spread, making it difficult to use your affected limb. It's as if your body is partially asleep and no amount of shaking or movement can bring back the normal feeling. This sensation can be both alarming and disabling, affecting your ability to perform everyday tasks. Have you experienced this sudden tingling? How did it impact your day-to-day activities? 7. Sudden trouble with motor skills, such as difficulty lifting an arm or grasping objects. This can manifest as difficulty performing simple tasks that require fine motor skills. You might struggle to hold a pen, type on a keyboard, or lift a cup. This can impact your ability to work, cook, or take care of yourself. Imagine trying to button your shirt or tie your shoelaces and finding your fingers uncooperative and weak. This difficulty with motor skills can extend to larger movements as well, making it hard to lift your arms above your head or bend down to pick something up. This can be incredibly frustrating as it interferes with your independence and an ability to perform basic self-care tasks. Have you or a loved one had trouble with motor skills? Share your story with us. Diagnostic procedures. If you suspect you or someone else is having a stroke, it's crucial to seek medical attention immediately. Time is brain. The sooner you get help, the better your chances of recovery. Doctors will start with a thorough physical examination, looking for signs of stroke, such as weakness on one side of the body, facial drooping, and difficulty with speech. They might ask you to smile, raise both arms, or repeat a simple sentence. These tests help assess the function of your brain's control over your muscles and speech. Imaging tests. CT scan. This imaging test can quickly show bleeding in the brain, which helps doctors determine if the stroke is caused by a hemorrhage or a blockage. The CT scan provides a detailed image of your brain, highlighting areas where blood flow may be obstructed or where there is bleeding. MRI. This provides a more detailed image of the brain and can detect brain tissue damaged by an ischemic stroke. The MRI uses magnetic fields and radio waves to create detailed images, allowing doctors to see smaller areas of damage that might not be visible on a CT scan. Blood tests. These can check for underlying conditions that might have contributed to the stroke, such as high blood sugar or infections. Blood tests can also help determine the levels of clotting factors in your blood, which can influence treatment decisions. Other tests. Electrocardiogram, ECG. This checks for heart problems that might have caused the stroke, such as an irregular heartbeat. An irregular heartbeat can lead to blood clots that travel to the brain and cause a stroke. Carotid ultrasound. This looks for narrowing or blockages in the carotid arteries in your neck, which supply blood to your brain. The ultrasound can show areas where plaque buildup has narrowed the arteries, increasing the risk of stroke. Treatments. Treatments for stroke depend on the type of stroke and how quickly you get medical help. Medications. Thrombolytics. These clot-busting drugs can help dissolve a clot that's blocking blood flow to your brain. They must be administered within a few hours of stroke symptoms to be effective. These medications can significantly reduce the damage caused by an ischemic stroke and improve your chances of recovery. Anticoagulants. These medications help prevent new clots from forming. They are often prescribed if you have conditions like atrial fibrillation that increase your risk of stroke. Antiplatelet drugs. These make your blood less likely to form clots. Commonly used antiplatelet drugs include aspirin, which can reduce the risk of a subsequent stroke. Surgery and procedures. Mechanical thrombectomy. A device is used to remove a large blood clot from a brain artery. This procedure is often performed if medications alone are not sufficient to restore blood flow. The thrombectomy involves threading a catheter through your blood vessels to the site of the clot and physically removing it. Rehabilitation. Rehabilitation is a crucial aspect of stroke recovery, focusing on helping individuals regain lost skills and adapt to any permanent changes. Here are the key components of stroke rehabilitation. Physical therapy. Physical therapists play a vital role in helping stroke survivors regain movement and strength. They develop personalized exercise programs aimed at improving mobility, balance, and coordination. These exercises can range from simple stretches to more complex movements designed to restore function to affected limbs. For instance, therapists may assist in walking practice, gradually increasing distance and intensity as the individual progresses. This therapy is essential for enhancing independence and restoring quality of life, enabling activities like walking in the park or playing with grandchildren once again. Occupational therapy. Occupational therapists focus on relearning daily activities that may have been impacted by stroke related disabilities. They provide strategies and adaptive techniques to assist with tasks such as dressing, cooking, and bathing. Additionally, they may recommend modifications to the home environment, such as installing grab bars or using specialized utensils to promote safety and independence. This therapy empowers individuals to regain confidence in performing everyday activities and resume their normal routines, like cooking a favorite meal or dressing independently. Speech therapy. Speech therapists address communication difficulties and swallowing problems that can arise from stroke. They employ various techniques and exercises to improve speech clarity, language skills, and swallowing function. For example, therapy sessions may involve exercises to strengthen the tongue and throat muscles, enhancing both speech and swallowing abilities. This therapy is crucial for enabling stroke survivors to communicate effectively with loved ones and enjoy meals without the fear of choking, ultimately enhancing overall quality of life. Things to avoid. If you've had a stroke or are at risk, there are several lifestyle factors to manage in order to improve your health and reduce the risk of another stroke. Smoking. Smoking significantly increases the risk of stroke by damaging blood vessels, raising blood pressure, and promoting blood clot formation. Quitting smoking is a critical step towards reducing stroke risk and improving cardiovascular health. Each cigarette increases stress on the heart and vascular system, making quitting essential for long-term well-being. If you've embarked on a journey to quit smoking, share your experiences and tips with others to inspire and support them in the comments section. Unhealthy diet. A diet high in saturated fats, trans fats, and cholesterol can lead to atherosclerosis, the buildup of fatty deposits in arteries, increasing stroke risk. Opt for a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats to support heart health and manage blood pressure. Limiting intake of salty and processed foods further aids in reducing stroke risk. Consider sharing your favorite healthy meal or recipe in the comments to inspire others towards nutritious eating habits. Excessive alcohol consumption. Drinking excessively can elevate blood pressure and heighten the risk of stroke. Moderation is key, with guidelines suggesting no more than 2 drinks per day for men and 1 drink per day for women. Excessive alcohol intake not only increases stroke risk, but also contributes to weight gain, further compounding health issues. Share your strategies for managing alcohol consumption responsibly and fostering a healthy lifestyle in the comments below. Physical inactivity. Sedentary lifestyles contribute to conditions like high blood pressure, diabetes, and obesity, all of which elevate stroke risk. Engaging in regular physical activity such as moderate intensity exercises like walking, swimming, or cycling for at least 150 minutes per week supports cardiovascular health and overall fitness. Share your preferred exercise routines and activities that help you stay active and resilient against stroke in the comments. Ignoring high blood pressure. High blood pressure is a primary risk factor for stroke. Regular monitoring and management are crucial for controlling blood pressure through lifestyle modifications like diet and exercise, as well as medications prescribed by healthcare providers. Maintaining optimal blood pressure levels is essential for reducing stroke risk and promoting long-term vascular health. Share your experiences and tips for managing blood pressure effectively in the comments section to encourage and support others in their health journeys. Understanding the warning signs of a stroke and taking swift action can save lives and improve outcomes. Early detection and timely medical intervention are crucial. Remember, every minute counts. Time is brain, and seeking immediate medical help can significantly enhance recovery prospects. Thank you for watching. If you found this video informative, please give it a thumbs up, subscribe to our channel, and hit the notification bell to stay updated with our latest health tips. Your support helps us continue raising awareness about stroke prevention and recovery. Remember, by staying informed and proactive, we can all contribute to healthier lives. Stay vigilant, stay informed, and most importantly, stay healthy. See you next time.